Right now I have registered for my PhD and just starting the work because my area of interest is pediatric optometry and with the public health thing and that. So I'm just trying to find out, develop a tool to detect the visual impairment, okay, to screen visual impairment in kindergartens, like 3 to 6 year olds. So you need a lot of, that is entirely different from what you do in normal ICAM because their charts are different, their cooperation level is different. You need a lot of patience. Children, if they are blind, the number of years that they have to live, if you take the percentage of blindness in geriatric and pediatric, it's more in geriatric. Definitely more in geriatric compared to pediatric, but the number of years the child has to live, when you compare the number of years, it becomes much more than the geriatric population. They may have to live another 50, 60 years. So if you calculate the number of years, it's going to be more with, you have 19 million around children with the problem, but then the years if you count, it is going to be much more than what is going to be there in the geriatric population. And if you can do something early intervention and early things you can do, then that will, their education, they can lead a life without depending on others. Otherwise, there will be always a burden for the family mostly. And if the family is not having enough resources, then they may not take care of the child only, because if they have many children, for example, mainly in developing countries, they'll have many kids. So whoever is blind, they'll be left behind and they'll take care of, because it's not possible for them to do for others. So if they can do their work themselves, they can grow up and at least they can be independent, which I think is something you can contribute to the society. I'm just passionate about that area. I don't know.